Hello, everyone. You're welcome to another Wednesday session with your fertility specialist. My name is Precious Adama, and I'm going to be your anchor for today. On behalf of Alps Hospital, I want to say thank you to all our viewers for your likes, your support, your comments, your engagement. We truly appreciate. And today, our topic is going to be fertility in your 20s, in your 30s, in your 40s. What changes? And to elaborate more on this, we have with us Dr. Jane. Good afternoon, Dr. Jane.
Good afternoon.
You're
Precious.
welcome.
Thank
It's
you
always
for
a
having
pleasure
me.
to have you.
Thank you.
So, for those joining us for the first time, Dr. Jane is a consultant gynecologist. She's a minimal access surgeon and she's a fertility expert here at Alps Hospital. Welcome once more, Dr. Jane.
Thank you very much.
So, by way of introduction, I feel we should just give a brief definition of fertility, if that's okay. So, what is fertility?
Well, fertility generally means someone's ability, yes, to conceive,
Okay.
yes, or for women within the menstrual cycle.
All right.
Yes, that is fertility.
Okay. Thank you.
On a
That's
broad
very,
scale.
very understandable. Thank you. So, why is it important for people to understand how fertility changes with age?
Well, fertility actually is not static.
Yes.
So it's important that people understand that over time, your fertility will change.
Okay.
That is independent of who you are and what you do. And so this understanding helps people plan their family
Okay.
or plan their future reproductive careers, and
All right.
also helps them to make informed decision when they have awareness about this decline that happens naturally.
Okay, that's very, very good. So I feel like most people have this conception, like these preconceived notions. Even I, when I was growing up, whenever we talk about infertility, we mostly refer to the women. Like, okay, somebody is not able to give birth, we feel like it's the fault of the women. So can you just like give a picture of what the man's role is in like infertility, what male infertility is like?
Well, the males have role in infertility, same as the women. In fact,
Okay.
it's said that if a couple is having challenges with conception,
Yes.
both male and female should be evaluated. Yes, over time, because the age associated decline in women is more pronounced and predictable.
Okay.
But for the males to have a role, over time, male fertility also declines, especially the sperm quality and the reproductive outcomes.
Okay.
So male fertility can also decline over age. And yes, men should be evaluated too.
Yes, that's.
Early.
I hope we're noting that. That's good. So we often hear that our twenties are the peak of our fertility years. And what are the actual monthly chances of someone having natural conception in their mid 20s?
Well, mid-20s are the peak of fertility for the women and even the men.
Okay.
So, and their cycles are more predictable, ovulation predictable, and spontaneous conception also almost predictable for the younger people.
All right.
So it's just the same thing we described. So most of them within a menstrual cycle
Okay.
can easily get pregnant compared as to the older folks or older age group women.
All right. All right. Thank you. So, if a couple in their early 20s have been actively trying to conceive for like the period of 6 months without success, should they be worried, or is there a longer timeline, or is a longer timeline perfectly normal for this age?
Well, any couple actively trying to conceive and haven't achieved conception within 6 months, it's a cause of concern, and they should seek professional help. Yes, even though we would say that infertility for people younger is when they have been unable to achieve pregnancy
Okay.
in 1 year, even when they've had regular, they live together and
Yes.
have met all the criteria for someone to get pregnant. But anyone that is concerned about fertility, within 6 months, you should also seek care because sometimes these things don't go away. It's
Yeah.
present in 2 months, it will be there in 6 months. If it's not sorted, it will also be there in 1 year. Yes.
Okay. All right. So I think like in your years of being a gynecologist, a fertility expert, you must have come across people that encounter premature infertility, like their early 20s, mid 20s, late 20s. Is that feasible?
Well, yes, just like you can have infertility, we talk about fertility declining
Okay.
as people progress in their ages.
Okay.
It can also you can also have infertility in younger age group. So
Okay.
common things that can cause infertility, like in the younger women, you can have the PMOS, formerly called PCOS,
Okay.
that has a way of affecting fertility. You can also have tubal blockage in younger people. They can
Oh.
also have what we call endometriosis. That's the lining of the womb found somewhere else, causing adhesions or
Okay.
scar tissues and also making it difficult to conceive. Then you can also have they can also have fibroids. For the male folks too, they can also have problems conceiving if they have poor sperm qualities. You can also see a male at in his 20s that is without even a single sperm.
Wow.
So all those fertility changes can be present in the younger folk, and that is why you should also seek medical help and be evaluated properly. So you don't just sit; it's not permanent. Fertility challenges can happen in all age groups. Yes,
Okay.
but when you are fertile, the younger age groups tend to be in their peak fertile period. So fertility is they can easily conceive and
All
all of
right.
that.
Okay. So, what fertility related habits or health decisions should people pay attention to in their 20s?
Okay, for the younger people, things they can do, they can maintain healthy weight,
Okay.
healthy diets.
All right.
They should prevent sexually transmitted infections because those can cause tubal blockage and also can also affect the urethra for the males. They can also seek help for other chronic medical conditions
Okay.
and also anything pertaining to their reproductive health, like irregular periods for the women, and pelvic infections from different sources and all of that. Those are
Okay.
things they should work towards because we said that fertility is not static.
Yes,
So
she's
it
made
keeps
mention.
declining as we age. So if you are fertile in your 20s,
Mhm.
you need to stay in good health to maintain fertility up until when you are ready to build a family.
Okay. Thank you. That's very, very insightful. So you made mention of diets being part of what keeps fertility or something like that. So I want to know, like, are there foods that we're supposed to avoid if we are watching our fertility? Are there
Okay,
like
not necessarily. Healthy habits, healthy diets doesn't
yes,
necessarily mean it's going to help improve fertility, but again,
okay,
it keeps you informed. It helps to
yes,
balance your hormones. You see,
okay,
when you take a lot of refined fat, obesity sets in, and these things have a way of affecting your hormones. And you
okay,
see, when there's an imbalance, menstruation becomes irregular, ovulation not predictable, and the
yes,
cycle goes on and
and
on.
on. Okay, so we can eat shawarma. All right, all right. Thank you.
Okay, so
That's that's good to know. Thank you. So why is the age 35 often being discussed when we're having fertility conversations? Like most people at age 35, like women are even pressured. Before you're
go
35,
and get
you
married.
should go and make sure you are married, women, men, everybody. Why is this age 35? What's so special about that age 35? Is that like a significant movement in the fertility journey, or what exactly happens at that age?
Well, with once as women or men, people approach age 35, yes,
Okay.
naturally, this decline starts to become prominent,
Okay.
becomes obvious. So for the women, air quality, quantity starts to decline naturally. Yes, it
Okay.
declines from the outset, from puberty, once the woman starts to menstruate. Because
Yes.
every woman has the fixed number of eggs she's born with. At
Really?
that, once you're born, you don't have new eggs forming. So by
Okay.
the time they get to when they start to menstruate, they lose these eggs for every cycle. So it's a
Okay.
natural process that would happen for every woman. But you see, when women get to 35, this becomes a lot more prominent. It
Okay.
becomes more aggressive, and once they hit 37, the curve is a lot. So the decline is massive. That is why another point in time, a lot of people, male females, are beginning to have medical conditions such as diabetes,
Yes.
hypertension. These conditions can also lead to miscarriages in pregnancy. And when they are pregnant, you can have miscarriages. And these conditions can also, with increasing age, there's also increased risk of having babies with what we call chromosomal anomalies. That's some
Okay.
abnormal babies can be formed and increase. This will also lead, the body tries to get rid of this by some form of miscarriages and all of
Oh,
that. So you
wow.
see that all this put together, you're having, and even your predictability of conception per
Yes.
cycle now is reduced as you age. So
Mhm.
all of this put together with even your risk of miscarriage and all of that will significantly affect fertility for both males and females.
Hmm. Wow. Thank you very much. So I like to say, like in the past, people got married early because things were quite easy. Like a 25-year-old male could marry an 18-year-old, and with their little salary, they could be able to take care of the family. But with the rising cost of basically everything, people have to like attain financial independence before you start a family. So let's say with the country we're in now, you could have a man still struggling at age 35, 36, trying to hold one or two together. Even a lady self, because these days women are not settling at all. They are working, they are trying to be financially independent just like the men. So what kind of advice would you give to those people that are not ready yet to settle down, but they actually have intentions of having children, but age is already pitching away and they're already, getting older, the eggs and sperm quality declining? So if you come across a couple like that, what no, not a couple, individuals like that, what advice would you give to them?
All right, so basically, for those that have plans for fertility in future and are
Yes.
not ready for a family yet, yeah, there are a lot of things you can do. First, you want to seek counsel with an expert where you'll be advised on your available options. Now, the options available, you can there's this. You can also have what we call egg freezing,
Okay.
so women
Yes,
can
sir.
freeze their eggs. You can also have sperm freezing. Men can
Okay.
freeze the sperms.
That's very
So, you
good.
know, it doesn't change. When you freeze it at in 2026, it remains the 2026 like
Already
sperm.
the same
Yes, and
amount you
also you can
froze.
also have embryo freezing. So this
Okay.
this is even you freeze the embryos, and once the woman is ready, the womb is prepared and the baby is placed there
Okay.
or transferred, as that's the appropriate word. So it's transferred into the womb and pregnancy starts. So those are options, and these options are not just for those that are not ready for a family yet. You can also have those that are undergoing medical treatments that can affect their reproductive organs, especially
Okay.
those that are going for cancer treatment,
Okay.
taking anti-cancer medications. This is also an option for them to preserve their family fertility and also give them a shot at parenthood.
Okay. Thank you very much. That was a very, very insightful reply. So, at what point should someone consider having a fertility assessment, even if they are not actively trying to conceive?
Well, anytime you can have, if you're not actively trying to conceive, then we can't put a
Yes.
timeline. But you can have anytime, for you that have a plan for future fertility, it's important that you have your discussion with your fertility experts who would
Okay.
guide you and evaluate you and prepare you for things that might be there that you are not aware of. So it prepares you for future the problems that are inherent that you can't see. So someone might have blocked tubes, but because it's not ready, so, but you see, with all of these things, you are now planning. So, if IVF is an option for you, okay, I'm not ready to have children, but I can have
Yes.
this in 6 years. Okay, I can plan to do this prepare financially, mentally, emotionally, and all of that, because it's
Okay.
a whole lot of preparation that has to go in. So you don't necessarily, there's no fixed time, but you
Okay.
need this awareness, you need this evaluation to prepare
Yes.
you for when you are ready. Because it's only when you have information you can make informed decision
Decisions. That's very
and say,
true.
okay, you might not want to have it now, but for some reasons, by the time you're evaluated and the options are there and pregnancy can happen, why not? And you're advised appropriately, financially ready or ready otherwise, then with that knowledge you have, some of those decisions you are taking at that time might become different because you are now better informed, and that is where informed decision
Comes
comes
in.
in.
All right. Thank you. Thank you. So I know you made mention of the decline in the ovarian reserve 3740, like it diminishes. So I just want to know, is there a possibility, like a 1 in 1,000 cases, that a woman in her 40s can give birth, conceive naturally
Yes,
without IVF?
yes.
Okay.
A lot of women have babies in their 40s. A lot of people start their families in their 40s.
Wow.
But
There's still
as
hope.
with age, it declines. So you the fertility option ability to get fertility becomes a little difficult compared to your 20s.
Yes.
And
Yes.
and of course, but if pregnancy wants to happen, it happens. So all those might not play a role. So yes, a lot of people can build their families, but it becomes difficult. And also with the age associated decline, air quality, quantity, and all of that.
Yes.
Yes, so now medical conditions setting, can have chromosomal problems
Oh,
and all
that's
of
an
that.
issue
But you can have normal babies, get pregnant spontaneously in your 40s and build a family in the
for both the
40s.
male and the female.
Yes.
That's very, very good. So between the male and the female, which has more rapid decline, or it's just the same for the both of them?
Okay, for the women, I think it's faster for the women
Why? It's
and a
not
little
fair.
slower for the men.
It's not fair.
There's something people always announcing biological clock for women. They say your clock
Yes,
is
every
ticking.
time. Every time.
Just because women have menarche when they at the onset of menstruation and also have menopause. But there's this misconception that looks like the men can be fertile forever.
Okay.
But so there's the decline is less. So you can see a 50-year-old man able to have good sperms and all of that. It's also possible to see a 45-year-old man, 40-year-old man with poor quality, quantity, and even movement of the sperms. So it's there's no fixed rule about it. So it's either way for both groups.
All right. So outside the biological clock, what lifestyle variables have the most measurable impact on fertility, on preserving fertility across all 3 decades?
Well, you know, healthy lifestyle,
Okay,
like
just that
healthy
you
habits,
mentioned. Yes.
healthy weight, that helps also balance your hormones. Treatments of chronic medical conditions, they have a way of affecting for the women and even the men. And of course, just consulting with your experts on your reproductive wishes and outcomes so things can be better. Yep.
Okay, okay. Thank you so much. So, many people view IVF as a guaranteed safety net, which is true. Why is it that IVF success rates also decline with age? And how does aging egg tissue impact reproductive technology?
Well, so IVF, ideally, yes, that's the misconception. Sometimes you think it's assumed that IVF will surmount those challenges
Yes.
that you have in the older age groups, not necessarily not older per se, in your 40s,
Yes.
for instance, but um, because of the aging process that has to do even with your uterine, the lining of the womb accepting the embryos you're transferring,
Okay.
the air quality that is dropping, and the quantity on its own, all of those factors have a role to play in in the 40s,
Okay.
making it difficult. So there are other factors. You see, in the 40s too, you see, the fact that you didn't start trying to conceive in your 20s and 30s
Early.
has not taken away the problems that might have been picked if you had started early. So
Okay.
even the tubal factor thing can be there, even though IVF is supposed to surmount all these challenges. But
Yes.
you see, the poor quality, the uterine environment also has a role to play. The fact that you start trying in your 40s does not mean that there might not be what we call fluid in in your tubes that can affect the embryos.
Okay.
So the whole, that's why pregnancy is not just the womb, the whole body too. The aging process that has to do with the womb, the surrounding structures can also affect implantation and makes IVF like a challenge for people. And that at that point too, you are discussing donor eggs and all of that for women, you see, because the eggs at that time, the quality is poor and you cannot
Yes.
access. So all those things can affect when you have poor quality eggs, poor
Okay.
uterine environment for the babies, because for some reason some other things might affect your lining. If the lining is
Okay.
not responsive to your medications, pregnancy might not, implantation, the baby might not sit in properly as you would,
Oh,
yes, and pregnancy might not take place. So not, it's not enough to transfer, the body
yes.
has to be prepared. And of course aging affects all the body structures, just
Wow.
like to affect the womb and all
Wow.
of that.
Wow. Wow. That's very insightful. So it's not just the air quality now. Even the uterus had undergoes some biological changes.
Undergoes changes and also
Yes.
has to be properly prepared
Okay.
for, yes, but you can do IVF successfully for
Yes.
older women. Yeah, even for those that have stopped menstruating, it's just to revitalize the uterus and
Okay.
pregnancy can go on.
Oh, revitalize the uterus. That's an interesting term. Can
Yeah.
you throw more light on
Like
that?
revitalize. So for a woman that has stopped menstruating, you see the
Yes.
hormones of menstruation are significantly or almost significantly reduced, I
Okay.
would say. So sometimes you need to give them those hormones to give the uterus a sense of this hormone is here, because some of them will cause
Okay.
some increase in size, increase in the muscular tissues and all of that. Gives you that lushness of a younger uterus to prepare for the pregnancy.
Oh, wow, wow, wow. That's good to know. That's good to know. Thank you so much, Dr. Jane. So I hope we're listening. We're taking notes. We are drawing from the wells of wisdom of Dr. Jane. That's very insightful. Thank you so much, ma. So in a nutshell, what advice would you give to people now? Let's say the Gen Zs, people that are still in their 20s but are not ready. They want to wait, they want to attain this financial independence before they go starting a family and all that. So what advice could you just throw to the audience?
Well, for the younger age groups, well, fertility is not static.
As you
So just
said.
live well, stay healthy, seek help wherever there's need,
Okay.
speak with your reproductive health experts to make better decisions, and of course, prevent sexually transmitted infections. They are significantly implicated in infertility
Okay.
issues in this West African sub-region.
All right.
So young people should take note of that. Of course, alcohol, cigarette smoking significantly also affects sperm quality and all of those.
Okay.
So we young people should be aware and try to live a healthy lifestyle. Then for people in their 30s, yes, normally we would say you're almost hitting the 35s. So it's okay to seek help and
Yes.
plan your family, freeze your eggs, freeze sperms, freeze embryos if you're not ready at the time. That's to give you a chance at parenthood and also remove the stress that comes with all the difficulties that will be associated with the older age groups. But for this is not, it's just to create awareness. Yes, fertility becomes a lot difficult at this time, but there are a lot that can be done.
Okay.
People get pregnant in their 40s, and even when it's not happening, IVF is an option,
Yes.
donor eggs is an option, and of course, we are here to
Yes, you're here.
listen and also put you through all challenges with fertility.
All right. Thank you so much. So there's just this one myth that people have. I'm sure it's a misconception. I just wanted to either be affirming or debunking it. So they said it's possible that infertility will pass down from mother to child. Is that possible? Like from a mother to her daughter?
No, not always true, but you see, infertility in the word cannot be passed, but it depends on now what is responsible for the infertility.
Okay.
Now, there are a whole lot of things that can be discussed when you are discussing causes of infertility.
Okay.
Now, a mother transfers, she's has PMOS, formerly
Okay.
PCOS,
Yes.
and her child had her female, her daughter has PCOS. If
Okay.
she had
That's true.
fertility difficulties, most likely because the pathology is still the same,
Yes.
she might experience the same thing. So she ends up with a child just like her daughter. The daughter too might experience the same thing, but with knowledge, of course, some of those things are now being surmounted. Yeah, so there are a lot of things. A daughter, a daughter now born with a genetic condition, no uterus, and all of that,
Okay.
chances of getting pregnant will not be there. So it doesn't mean transferring infertility is not a possibility,
Yes.
because if the woman has a daughter, it means that yes, probably she had fertility challenges along the line.
Yes.
So evaluation will now determine what caused it. So it depends on the cause of infertility.
Okay.
So if it's something that is transferable, if it's genetic, then you might think better. But if it's from blocked use, which is from probably infections commonly and infants, if the child is not exposed, so it's genetic factors, yes, it can mimic itself in the daughter, but acquired things as life goes on might not necessarily be transferred to the child.
Right. Thank you so much, Dr. Jane. Our time is far spent, and I think we've come to the end of this live session. Thank you so much, Dr. Jane. Thank you to every one of our viewers watching. We really, really appreciate your presence. Thank you for this session. We should always remember all the things that Dr. Jane has said. We should take our fertility journey seriously. We should watch our bodies. We should watch our diets. We should stay healthy. And when you need to talk to your fertility specialist, you should do that. Thank you so much all to all our viewers. This is the end of our live session. Make sure to catch us next time. Don't forget 3 p.m. We're all have a lovely evening. Thank you.